Hi, good afternoon. Thank you for being here. My name is Rebecca Fast, and I work in Parent University, and I'd like to welcome you all for being here today as we start our first in a series of 4 parent education series for kids or for parents who have little ones at home. We've done a lot of parent workshops. This is our first series for pre-K families and for pre-K guardians. So together with Educare, we're very excited to bring you this workshop. I'd like to introduce our guest speaker today. Her name is Lauren Bauman. She's one of our Long Beach Unified speech pathologists in the district, so she's going to be giving us a lot of information on language development for our little ones. For those of you who are watching us at home, the comments section is open on our YouTube page, so feel free to ask questions from home as well, and we'll be responding to and answering as we go. So without further ado, I'm going to pass the microphone over to our guest speaker here today, and again, thanks for tuning in.
So I am Lauren Bowman. This presentation was actually completed by Megan O'Brien. Unfortunately, she wasn't able to be here today for unforeseen circumstances, and at the last minute, I got the phone call, so here I am. I'm going to do the best I can going through her presentation. I am a speech-language pathologist here within the district. I've been with the district for about, I'd say 13, 14 years now. I'm currently over at Alvarado Elementary School in Signal Hill, where I've been there 10, 11 years now. I am a speech therapist, so I do talk really fast. And if anything at all doesn't make sense, please raise your hand, stop me, and I'm definitely open to questions and for clarifying anything.
I'm going to actually interrupt you. I'm going to steal that microphone. Do you have the mic here? Yes?
Yes.
Okay, good. Excellent. Thanks.
So, and if you can't hear me, let me know too. So, we're going to go through this really fast, and the beginning parts of it, again, if you have any questions, please interrupt at any time. So first and foremost, you are your child's biggest teacher and influencer in their life. You are their best teacher. Nobody can replace a parent and their parents' love. So we're constantly encouraging parents to do everything that they can with their child at home. We're going to run through typical development in different age groups. We're going to look at hearing and understanding and talking. So from a speech and language standpoint, whenever we're looking at language, we look at receptive and expressive language. So receptively is the hearing and understanding component, and the talking is the expressive language component. So we're always looking at both of them together. Receptively, the hearing and understanding, again, is how much your child understands. The talking is how much they express and what they're able to say. So language always has those two components. There are a lot of times when little ones can understand a lot more of what you're saying than what they can express. So typically, for birth through 3 months is when you start hearing a child cooing and gooing and making those sort of sounds. Gooing comes before cooing. They're differentiated in the sound production. Usually those babies will start with vowel-like sounds, and then you'll start getting other sounds with vowels and consonants. So we get into some of the things that you can do at home for birth to 3. Really spending time and bonding with your baby is really the best thing you can do. We always encourage reading from the very, very start, keeping books simple and short, simple pictures. Songs are great as well. They don't need to be formal songs. Anytime you're doing any sort of routine, if you make up a song, is really beneficial to your baby as well. Again, some cues that you might look for in your little one are when they look away from you, if they're fussy with too much stimulation. Really, this is where your foundation for conversational skills begin. When you get the eye contact, they're looking at you and they're engaging back and forth with the speaker. Any questions about that so far? I did want to note really fast here, there is the American Academy of Pediatrics does address screen time in little ones. I do have to say I'm a huge proponent of screen time and technology used in the right way. But for children younger than 18 months, they say to avoid screen media altogether. I do believe in screen time used appropriately. Again, there are great apps out there that do sing songs that you can engage in. Putting your little one in front of an iPad and not engaging with it probably isn't recommended. But even for little ones, I have babies in my family, I do set them up with apps and have them watch it and, take them away, give them back, take them away, and give them back reciprocally. We're going to go through 4 to 6 months, again, the hearing and the understanding component. So this is where your baby will start babbling, and you'll start getting what we call bilabial sounds. As a speech therapist, that's what we refer to them as. So those are sounds where your lips start coming together, such as the P and the B and the M. You'll notice that typically those babies will move, their eyes will move in the sound of the direction. And they'll engage in cause and effect toys that make noise, whether it's on or off. Again, simpler toys are probably better than battery-operated toys, although those toys that do make music and do respond to a touch are great too. But you can definitely engage in those toys that don't have batteries just as easily as you can with the ones that do. This is when your baby will start to vocalize with excitement and displeasure, and then we'll make the gurgling sounds when left alone or playing with you. Any questions about that? Okay. Things you can do at home with your 4 to 6 month old. Again, it's really similar to what you can do with your 0 to 3 month old. Talking to your child about everything is great. Keep it super simple. Simple one words to label objects and to talk about what you're doing. Continue to read daily, singing, imitating their sounds. Imitating their sounds, if you could build upon what you're doing. So if your baby is ma, 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 give them another sound, but just as simple. Pa, 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 ba, ba, ba. Adding in either another consonant or another vowel. Begin to use words like, uh-oh, wow. Adding in animal noises are great too. Having a cow moo, 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 over and over and over again. So we get into 7 months to 1 year. Again, we're going to go through the hearing and understanding and the talking component of it. The biggest thing with this one is the variations in babbling. So you can see they'll start to enjoy the games of peekaboo and patty cake, which are awesome games to play with them. And keep it really slow. You don't need to go over it. Peekaboo, peekaboo, peekaboo. If you could engage them, peekaboo, peekaboo, and pretty soon if you could leave off the boo and see if they can fill it in is a great strategy to use. They'll start to look around the room. They start to scan the room and listens to when spoken to. So you can start noticing your baby will start making eye contact with you. If your baby doesn't make eye contact with you right away, it doesn't necessarily mean there's something wrong, or if they don't sustain eye contact either. But as long as they're turning in the direction of a speaker and noise. Recognizing common words. They should start to recognize words that are salient to them and important to them. So those are words cup, shoe, more, juice. You'll start to notice variations in babbling as well. This is where you'll start to have 1 to 2 words, typically bye-bye, dada, mama, papa, although they won't be clear. And if mama comes out as ma, that's okay too. But again, to encourage multiple consonant vowel productions is great.
I have a question.
Yes.
I have a question from somebody watching at home, from Jody Banks. She's asking, why is there so much push on speech? It seems in the last 2 years there's been a bigger push in speech. Maybe why this focus on speech is so important at a young age?
That is a good question. I'm not really sure why there would be a big push in speech. I would imagine it's probably more resources available and more early intervention available. So we're picking up kids with delays in speech and language probably a lot sooner than we would have in the past. And we have a lot more resources available to them now. In the school setting, obviously, a lot of it is conversational. So you have to be able to understand what you're being taught and what you're saying. So we want to get those kids speaking and listening as quickly as we can. And professionally, I'm a huge proponent of early intervention and doing as much as you can for the little ones to get them up to speed.
Thank you. We also have a question from a parent of a 4-month-old, about to be 4 months. When they're reading, should they be pointing at the words as they're reading? Is that important?
I wouldn't go to pointing at the words. I would point to pictures. It never hurts to point to the words. I would use, with a 4-month-old, I would use books with single pictures or very simple pictures and point and label those pictures. The words are going to be very engaging for a little one. Same with a toddler, even when we're looking at 1-year-olds. I would think of the book, one of my favorites is Brown Bear, where it has a simple picture on one page and another picture on the other one. And you can do so much with that. Pointing to the picture bear, you can expand on it. Brown bear, bear says roar, and get really into it before turning the page. I wouldn't necessarily go through the words. It never hurts. You can always do it. Focus on the pictures, though. You're welcome. Any other questions so far? Okay, I think I did all of these ones. Okay, so there's a lot you can do with this age group at home. Again, playing patty cake, peekaboo, and other interactive games are perfect. They're amazing. Label common items all the time. Label, label, label until your child has a whole bunch of labels. Then start expanding on it. Interpret what they're trying to tell you. If they point to a cup, say cup, cup. See if they can imitate the cup. Oh, wow, you see a cup. Changing your intonation and making it really exciting for everything. Really, with these little ones, you don't have to have anything fancy. You don't have to have a whole lot of toys and objects and that sort of thing. As long as you get really into it and really exciting and you're really enthusiastic, you can engage a little one with anything. Continue to imitate their sounds and actions. Imitate while adding on more sounds and more words always. You're not just going to imitate the same thing that they're saying, you're just reinforcing the sounds that they're saying at that point. And sure.
A esa edad les tenemos que empezar a hablar y decir palabras y todo. ¿Les afecta que uno como abuelita les hable apapachado?
So at that age, from 7 to a 1-year-old, does that affect if grandma talks to them like baby talk?
I guess I kind of want to clarify baby talk. I would always encourage whole words. Imitating babbling sounds are fine, but I would encourage normal voice and normal intonation. Baby talk is not going to harm a child by any means. Speaking in another language isn't going to harm a child either. You want to make sure that you're enthusiastic and that you're doing a good model for them. Whatever you're modeling for your child is what they're going to pick up on. So at a certain point, I think engagement is key at this age. So baby talk going back and forth, as long as you're engaging, is fine, but I would continue to build upon whole words as well.
Yeah, because all the time my daughter say, Mom, speak really clear. When you talk with the baby, speak really clear. I am grandma all the time say, oh my baby, a little baby. I speak 2 languages. I try to speak Spanish with my grandchild, but my daughter all the time say, no, speak really clear. I am grandma. Please, please, I speak a little, I don't know how can I say in English, apapachado.
Baby talk. You know, it's as long as you're engaging and you're enthusiastic and you're varying your intonation and you're modeling good words, you're fine. You're fine. Yes. Any other questions so far? Yes.
Is it okay because I speak to her in English and in Spanish? Is that going to confuse her, or should I just stick to one language?
Okay. So the question was exposing your child to 2 languages. And the answer is a child being exposed to 2 languages is not going to cause a language delayed child. It's the exact opposite. They're actually going to learn more language quicker. Acquiring 2 languages, I could do a whole other presentation on that from a speech and language standpoint, but absolutely not. So I usually encourage my Spanish-speaking parents, whatever language they may speak, to speak to your child in your home language. Typically, when you're speaking in your home language, you are more animated and you are more engaging and you're more comfortable, and your child is going to pick up on that. So I do encourage it. I highly encourage it. And if it's part of your family and your child needs to learn 2 languages, by all means, absolutely. And the research definitely shows that there is no correlation between it. Any other questions so far? Okay. I think I hit upon everything on this one. So we get into 1 to 2 year olds. This is really where a lot of speech and language development occurs in this time frame. So again, understanding is pointing to a couple body parts when asked. We typically start with body parts, clothes, again, those things that are really salient to 1 and 2 year olds. They start to understand simple directions, just very simple concepts, again, that mean the most to them. If they have a ball, rolling the ball, kissing a baby, if they understand what a baby is, where's your shoe? Again, all those things that are personally relevant to them. They should begin to start naming, pointing to pictures in a book when named. And if you can get them to point to it and say the label, that's great, and then expand on the label, even better. They should say more words every month. We're going to get into using different consonant sounds at the beginning of words later in the presentation. I'll briefly go over that. We do refer to those consonant sounds as articulation in the speech world, in case any of you have heard that term. We'll get into that as well. But typically, 1 to 2 year olds will have about 50 words that they should have in their repertoire. It doesn't need to be 50 clear words, 50 word approximations. Again, if your 1 to 2 year old doesn't have 50 words, it's not a red flag all the time, but we're looking for multiple, they're still acquiring multiple words at that point. Any questions about that one? So there's a lot you can do at home with your 1 to 2 year old. This is really where you want to start making books come to life. I love books. I'm a huge fan of books. I highly encourage going to the library, checking out books. You really want to make books come to life at this point. That's changing voices with different pictures and characters, acting out pictures in books, having your child act it out as well. You can take Brown Bear and act out those animals while making those animal sounds is awesome. Again, I know I kind of mentioned it. Once your child learns labels and has nouns, and they have quite a few of them, avoid asking what's that, but continue to expand on their language. So bear, you want to start adding in the adjective, brown bear, red bird, that sort of thing. If your child sees a cat, instead of asking what's that, you can say that's a cat. The cat lives in the house, then follow it up with where does the cat live in the house. You can do a lot of front loading before asking the question for 1 to 2 year olds to get them to start answering questions on topic. Any questions about any of that? Labels are great, nouns are great. They're very easy to acquire. So, and that's a lot of where speech and language development starts, is with simple labels. So as soon as you can get a couple simple labels, start expanding and adding more parts of language, whether that's verbs, those are your action words, adjectives are your describing words, colors are great. Using those verbs that your child can do, running, skipping, hopping, again, great words to add in. The other thing, always make sure when you're asking those basic WH questions, pause and allow your child time to answer. And it can be a little bit uncomfortable at the beginning when you're waiting for them to give you an answer. We always wait about 10 seconds. A lot of times these little ones have a delayed response time. So if you ask the question and ask the question, you're just postponing, and they're processing and processing and processing. So by allowing that wait time, it'll allow them to come up with the language that they need to answer the question. Any questions about that?
Oh, since we're talking about sounds and noises, some of the children are not supposed to watch TV, but they might watch 30 minutes, an hour. What's your take on that? Because my daughter, she watches certain educational shows, and at 22 months, she's just now actually singing the whole song or recognizing colors because of the things that she's watched. But I try to do more of just turning off, because that's other meetings, and the teacher's been talking about just engaging more, like you said, instead of the TV, because with the TV, they kind of just come up with their own thing, versus when they have the mommy or daddy time, it's more like she'll nudge me and get the book, and she does this now, and she wants to read a lot.
Yeah, that's great.
With the TV, she's like, if I walk past the TV, she wants me to hurry up and move out the way.
Well, she's engaging with the TV. She's not engaging with you.
Right.
I love technology. I really do. I incorporate it into my therapy all the time. So the TV, I have no problems with telling a parent to put your child in front of a TV. Now, do I think they should come home from school and sit in front of the TV for 5 hours? No. I do think quality programming is excellent. There are educational shows out there that are very beneficial. And during those commercial breaks, if you could engage in what you guys watched on TV, that would be awesome. Asking who the characters were, what animals were there, retelling the sequence of events in the story. Your child doesn't have to tell you it. If they could use the language that they have to use a label to answer, who was in the story, where they were, if they were at the park or at school, simple questions like that, and then you could expand on their language. You can use television to its advantage for those sort of things at home. But I don't recommend 5 hours in front of the TV.
Right.
In the afternoons, no. But I don't have a problem with quality programming, as long as you're engaging your child in it.
Okay.
It would be great for speech and language development done appropriately.
Okay, thank you.
Anyone else?
A question from home. Somebody had asked, when do you notice, when might you notice a problem? When might you notice a speech problem as opposed to just baby talk and kind of babble? What would be some clues that you could have?
That's a great question. It's a loaded question. Later in the presentation, we're going to get into those red flags from birth to 3, and then we're going to go through the different age groups of red flags. If your viewer at home has a specific age, I could answer it really fast, though, if you want to ask.
It was 1 to 2 years old.
1 to 2 years old. We are going to hit that later. Okay. So now we move on to typical development for 2 to 3-year-olds. Again, this age is where significant language and development, growth and development occurs. Children are beginning to understand more complex concepts and begin to string words together. At this age, they're sponges for everything. They're constantly listening, even if they're not looking at you and engaging you, they're taking it all in. This is one of my favorite age groups. I love 2 to 3-year-olds. I've always said they're little people with big opinions. And this is where they begin to realize the power of their words and their actions. And they can be very, very opinionated at this age. I do really like it because at this point, you can really engage your child for what they really want because they have strong desires. So 2 to 3-year-olds typically have a word for everything. They're usually stringing 2 to 3 words together. And so we always say that the amount of words a child should be putting together is for the age that they are. So 1-year-old should be using 1 words. 2 to 3-year-olds should be using 2 to 3 words. 4-year-olds, 4 words, typically putting together in an utterance. Speech is understood by familiar listeners. So when we look at understanding what a child can say, again, from a speech and language standpoint, we always want to make sure that a familiar listener is people who interact with that child every day. So that's the parents and other family members. Unfamiliar listeners would probably be people out in the community, people at the park, even some teachers. I consider myself a familiar listener because I am a speech therapist, so I typically hear different variations of speech throughout my day. So the average person outside of your family is not a familiar listener. So speech in 2 to 3-year-olds should be understood by the majority of people within your family. Now, if somebody outside of your family doesn't understand it, it's not necessarily a red flag. Any questions about that? Does that all make sense? Okay. 2 to 3 year olds begin understanding different concepts as sizes I have here, up and down, different concepts, in and on. So we look at those prepositions. We begin to introduce those prepositions, which are different locations, whether they're in, on, next to, in front of, beside. And again, that's understanding. It's not necessarily using in their language. So talking, they often ask or direct attention to objects by naming them. So they're able to point and name and get exactly what they want. What you can do at home for 2 to 3 year olds. There's a lot you can do with them. So always repeating what they say. Do not expect them to say it back. I am a fan of modeling and attempting to have your child repeat it back, whether that's expanding on an utterance or a word that's not said correctly. Now, you don't need to do it over and over and over. I would attempt it. If your child does not say it back or add on more words, move on and continue on at that point. But I do encourage a constant model and attempting to have your child repeat it back. They learn great language skills from that. Spending time with your child and acknowledge the things your child is saying, their thoughts, their feelings, their desires. Any attempt at language, definitely acknowledge it. Asking those simple what and where questions. We usually start with what and where questions about pictures, stories, activities that they're doing. What and where are the simplest WH questions to start with? And they're simple because they're the most concrete. So when you're looking at where, you're answering with a place. When, those when questions, those typically answer with a time, and it's a more abstract concept. Again, it's not necessarily what is this, what is this, what is this. You can move beyond what do you need for, that sort of thing. Limit time on electronics, although again, if you use it purposefully, I'm a huge fan of it. Even if you're on an iPad and you're taking the iPad away and giving it back, taking it away and giving it back, depending on what you're asking them to do. A lot of apps for 2 to 3 year olds are identifying, labeling, moving. If you could encourage a pointer finger on the screen is awesome. If they could label what they're gonna touch, take it away, have them say the label of it, touch it, they get it back. And making an iPad really interactive is awesome as well. Again, it goes all back to the high quality programming and what you're using it for. Typically for children 2 to 5, they're saying to limit your screen time to an hour a day for high quality programs. An hour a day. Any questions about that? Yes.
Comment. I'm not sure how to phrase this, but so I know you're talking about express language, about what they can actually say. Mm-hmm. So I know with my 6-year-old, who's a typical kid, we started, before she could actually start using words, we started to talk to some simple sign language, some baby sign. Mm-hmm. With my 3-year-old now, 3.5-year-old, who has Down syndrome, we really went all in with Down syndrome, with sign language, because we expected her to have some delays in her express language. So what we found, my wife and I found in doing some research with sign language, is that it's the same neural pathways that are laid down with sign language, mm-hmm. are the same ones that are going to be used for express language. So I'm not sure what I'm trying to get at, but I guess if you could extrapolate for a bit as you go along what you're saying for the express in the spoken word, that's also for sign language, if that's, if you know of any correlation there.
Yes, so I highly encourage sign language as well. Any sort of gesture. It doesn't need to be an exact sign. Gestures are great, sign language is great. It's a language in itself. So it is considered an expressive language. Sign language does show that it is correlated to expressive language. It definitely helps facilitate language and communication by all means. Sign language does not have an impact negatively on expressive language. So I do encourage the use of sign language as well, especially basic signs, more, want, those sort of things that are really, again, salient to your child. I personally don't know sign language. I know basic sign language, basic signs in order to communicate with my kids. It is definitely something I wish I had learned because it does have a strong correlation to expressive language, for sure. There are great programs on YouTube and online where you can learn simple signs to incorporate, especially with babies and infants. I do think it's great too. I agree with you. I think it's a definite positive step in the right direction with a lot of speech and language development, for sure. So I don't discourage the use of signs at all. And again, it would be more of a gesture. You don't need to have, more doesn't necessarily need to be the exact sign for more. As long as you're bringing their hands together. If you think of another sign within your family as a gesture, for sure, it's definitely a form of expressive communication. Sure. She's going to get you a mic.
Yes. Oh, no, I was just going to add to that. We did sign language with him, and I worked with special needs in a previous lifetime. But for hearing children is to add a sound to the sign when you're doing the sign, because oink, 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 might look similar, but when they're saying oink, oink, then it's pig that they're signing. So to do the sound and the
Yeah, I would
sign.
always add in the verbal label as well. Definitely. Thank you. Okay. So 3 to 4-year-olds. They will go through, you can briefly read the hearing and understanding and the talking component of it. So this is really where they begin to be able to have reciprocal conversation skills. They begin to engage in imaginative play, typically princesses, dinosaurs, those sort of things, again, that pertain to 3 and 4-year-olds. I highly encourage beginning to sequence and retell daily events that you're doing. So if you're brushing your teeth, telling them first we take out the toothbrush, then we put toothpaste on the toothbrush, then we brush our teeth. You start teaching those sequencing skills, the retelling skills, so that they can carry over into bigger parts of language and what a student or child did during their school day. I've always said that 3 to 4-year-olds is where tattling begins. It kind of goes with the retelling. I encourage tattling in the little ones because, again, you get a lot out of them, and it's something they really want to talk about, and you can really build upon their language skills from tattling, and it's kind of fun. So again, some things you can do at home with your 3 and 4-year-old. Going to the library is great. I highly, highly encourage librarian books. Keeping the books simple, always simple. Even at 3 and 4, you can start to point to words at 3 and 4, but again, I would keep it to the pictures and describing pictures. Even if you show your little one a picture and have them describe it to you, have them tell you what's in the picture, what's happening. And you could even tell them what's happening and then, just like I said before, front load the answer, ask the question, have them repeat the answer back to you. And again, those sequencing activities are great as well. And continue to sing, continue to do those fun things, continue to engage your child. Again, adding in more parts of speech with colors and sizes and shapes, always using correct grammar. And again, if they don't say something correctly, this one says don't expect them to say it back to you. Model it correctly, attempt to have them say it back correctly, and then you can move on from there. But I do highly encourage trying to have them repeat back what you're saying. Questions? We're good? Okay. 4 to 5. So this is where you can begin to carry on a reciprocal conversation with your little one. There are very, very verbal 4 and 5-year-olds, and then there are some 5-year-olds who are 4 and 5-year-olds who are not as verbal. But they should be able to go back and forth in a conversation and keep up. They can clarify meaning and realize when they're not understood, and they can ask for clarification when they don't understand something. Any questions about any of this? This is where they can start sequencing, retelling their events in their school day. They understand a lot of what is said and done at home and at school. They can follow classroom directions to complete simple tasks. Okay. So these are some different things you can do at home and at school for 4 to 5-year-olds. And again, it goes back to reading and singing, engaging your child all the time. Playing with words, so encouraging rhyming words, alliterations, and segmentation. So when we talk about those sort of things, we talk about, like if you take a simple CVC word, which we consider a consonant, vowel, consonant, let's say we have cat, dividing it up into sounds, putting the sounds back together. You could even swap out the first sound, add in, mat, see if they can come up with the sound, segment the word, put the whole word together. They teach students we highly encourage students to play board games. I love board games for speech and language development as well, any sort of games. You don't need to play by the rules. You can modify the rules to make it appropriate for your child, and definitely teaching the winning and the losing skills. So I don't want to say purposefully sabotage, but purposefully sabotage the game so that you can have winners and losers. And make up your own rules as long as they're able to turn take, which is a big one. Encouraging whoever they're playing with. If they're playing with you, you can encourage them back to model good winning and losing skills and following directions. Another thing to begin to do with 4 and 5-year-olds is to review the day, to talk about what they did during the day. Today and fill in the day's events, what they did. Tomorrow we will, and talk about tomorrow's events so that you can start teaching past and future tenses. Questions? Okay. So this is a sound production chart. These are norms for sound production. And you can see the ages that it's listed, and then initial, medial, and final consonant sounds. So what we look for from a speech and language standpoint are those initial sounds. So those are sounds at the beginning of words. Medial sounds are sounds in the middle of words, and final consonant sounds. So as you can see, 2-year-olds, the initial sounds are your basic babbling sounds you should hear, medial and final. They don't always acquire those sounds at the beginning of words and at the end of words. So a typical 2-year-old will acquire these sounds at the beginning of words, but maybe not the B sound till the end of their 3-year-old year. Does that make sense? Okay. We also look at sound development by what speech therapists call phonological processes. So those are the way in which sounds are produced and where they're produced in your mouth. So we typically look at those initial sounds, or what we would consider bilabial sounds. So those sounds are produced with your lips together. Those are simple sounds to produce. And with little ones, those are sounds that you can model for them and that they can see. For instance, modeling a K sound or a G sound is produced in the back of your mouth. It's a lot harder to model that because there's no visual for it. As you can see, there's a whole bunch of sounds here. Typically, as a speech therapist, we look for a little one making those what we consider high impact sounds. So those sounds that occur in words all the time. Sounds such as the S, R is a high impact sound, K is a high impact sound. Low impact sounds would be the V sound, the Z sound, words that, they're in words, but they're not constantly occurring in words. Any questions about sound production and sound acquisition? Yes.
My child will struggle saying a simple word like Kim. She'll say him, but she'll say kangaroo, but she won't say Kim. How can I help her? She's 2. She'll be 3 in April. How can I help her with that, since it is in the back?
It's a hard sound to make. So, okay, so with 2 and 3-year-olds, I get that a lot. Usually those little ones that have the sound in one part of the word at that age, so let's say they have it at the beginning of the word, the middle, or the end, they will acquire it in other parts of words. So in a 2 or 3-year-old, I'm looking at those sounds that a child does not have at all. Those sounds would worry me. So if a 3-year-old came to me and didn't have a P, an M, or a B, I would probably look at those first, and then I would move on to their other sounds that as a 3-year-old have. Now, if they had it in part of a word, I'd work on it and I'd model it for them, but typically they're going to acquire it. So if your little one has a K and they're just don't have it at the beginning of the word, but they have it in the middle or the end, I would say you have a really high chance of it not being an issue. Model it for them for a few weeks, and I would imagine that your little one will probably get it. You can use very light tactile prompting and to let your little one know that the sound comes from back here. Other than that, I would wait until your child was almost 4, and if they don't have it by then, I would look into something for it. But typically, I think you're going to be just fine. Yeah.
I have a 3.5-year-old, and she has a severe phonological delay. Is there anything you recommend at home to work on outside of the other things that we discussed, like repeating like the correct way to say it, but modeling, or if she's receptive to me modeling for her, or what would you recommend?
I would probably have to look at your speech report or your IEP goals specifically. But I would definitely say, obviously, modeling it and breaking it down even to the single sound level. So that's the other thing. So when we're looking at sound production, so we look at if that little one can make the sound by itself. And then we look at it if they can make it with a vowel sound before and after. So we go, you'll have that consonant sound, we'll add in a vowel with it. Before we're putting it into simple words, before we're putting 1 to 2 words together with that sound in it, simple phrases, 2 to 3 words, before we're putting it into a sentence, into a paragraph, into a story, into conversation is typically the carryover for it. So I would have to, again, talk about the different phonological processes that are, is going on with your child. But I would definitely consult your speech therapist on that one, and then I would break it down to a single sound level, especially with a little one. And my professional opinion would be to model it for your child, attempt to get it. If they're not able to do it after a few attempts, do not continue to work on it, because you don't want to reinforce an incorrect production of it. Now, if you can get it by itself, I would practice that, do as many repetitions as you can. The more times you do it, the more often they're going to use it. But again, I'd have to probably see exactly what your phonological processes are. I love sound production. It's one of my favorite things to work on personally. So I could answer your question after if you can give me a little bit more information about it.
She says, my 4-year-old cannot pronounce his L sound. Also, R is difficult. Is this normal? Should I consider speech therapy? He replaces R with W, for example.
Okay, let's start with the R. The R is really tricky. And I'm going to say for right now, the R is going to be developmental. So this chart has R acquiring at the end of a 6-year-old year. As far as the L goes, according to this chart, would be he or she should have it by the end of their 5-year-old year. With a 4-year-old, I professionally would probably start working on the L. For that one, I wouldn't probably work on the R until I got the L. And there is a good chance too, if they acquire the L, they might get the R sound with it, depending on the production and how they're producing that R sound. Any other questions about that
I
one?
do have another question
Sure.
here from a family. It says, I have 5-year-old boy and girl twins. My girl is really advanced, but my boy has trouble pronouncing R's, W's. We also speak multiple languages at home. Does that influence speech development? And I know you had already spoken to that part of it, but
the multiple languages does not negatively influence speech and language development. It positively does. Again, it was R, what were the other sounds?
R and W.
R and W. So the R is the end of the 6-year-old year. At 5, I professionally would probably work on it at 5. My colleagues would probably disagree with me, but I professionally would work on it. There are quite a few speech therapists out there that would work on it, though. As far as the W sound goes, I'm not sure I've ever actually had a W error, so it might actually be an R error or an L error that's sounding like a W would be my guess. And I might, if it's really impacting the child's ability to understand what they're saying professionally, I would probably work on it. Yeah.
And then this came up a couple times also from the Guardado. Is there a difference between boys and girls in speech and language development?
Is there a difference in development? It's kind of a loaded question to answer too. I could probably do another presentation on that.
He's saying his daughter developed much faster, and his son isn't developing the same, so should he worry?
One, don't compare your children ever to each other. Again, I'd probably have to do some sort of assessment in order to say, should you be worried or not? As long as your child is speaking and using language and communicating, you're doing the right thing. If you have any concerns, though, at 5, it was 5? 4?
The second question was a 2-year-old.
A 2-year-old. No, I wouldn't worry at 2. I would not worry at 2. Any other questions? Yes.
So hopefully you can hear me. Okay. So you had talked a lot about how you're a huge in favor of apps and things of that nature for teaching our children how to both be at par and hopefully advance. So in terms of working on these LRW sounds, things like that, do you have like a preferred app list that you could share with us? I know that's probably extremely extensive, but if you could help us just with some of your favorites, maybe your top 3, top 5.
So yes, and I brought my iPad, so I can show you guys those apps as well. I am going to say, as far as an R goes, leave it to a speech therapist. Same with an L. What I would encourage, if you have any concerns at all with 3 or older, they have to be 3, take them to your local school and ask for a speech and language assessment. Your speech therapist at that school site will be able to do an assessment. You can just walk into the front office and make that request yourself. If they're under 3, consult your pediatrician, and we're going to talk about other services and programs that are available outside of that. But any concerns at all, I would recommend you walk in and have an assessment done. Again, those errors are very, very typical in little ones. You're going to get an R error for a lot of years. Don't worry about an R error at all. You're going to be okay with the R until this chart says the end of the 6-year-old year. I would begin working on it at 5. Oh yeah, I can give you those apps as well. Yeah, I brought my iPad, I can show you those. Yeah, no problem. Any other questions? Okay. So this one is the Spanish Developmental Articulation Norms. As you can see, sound development is different for different languages. You don't need, so this is basically for informational purposes only for you guys. Okay, so we get into red flags that may prompt a referral to, it says HRC up here, so that's Harbor Regional Center. Is everyone familiar? Everyone knows what Harbor Regional Center is? Okay. You don't know what Harbor Regional, okay, so Harbor Regional Center is a private not-for-profit corporation that provides quality services, support information, and choices of people that have developmental disabilities and their families to promote participation within their community. So typically it's Harbor Regional Center and the district worked together. The district typically takes over at 3, and the Harbor Regional Center provides services up until 3. District takes over at 3. Harbor Regional will always stay in the picture with little ones as well. So any red flags? These are a few red flags here for birth through 4 months. Now again, your child doesn't necessarily, can do some of these. It's not necessarily a huge red flag if they're not holding their head up, they're not showing anticipation at feeding time. We just wanted to go over and just briefly talk about those red flags, birth to 4. So red flags, 6 to 12 months. As you can see here, some of the ones I wanted to highlight really was that the lack of affect, smiling, not showing excitement, You should definitely hear babbling and cooing. If you don't, that's a red flag. It talks about object permanence here. That's when you're, engaging with your little one playing. Your child should search for different objects. You put it on your head, they should look up to your head. Put it behind your back, they should know it's behind your back. No single words by 12 months. It doesn't need to be clear words. It can be word approximations are just fine. Any questions about red flags in this age group? Okay. So 18 months to 2 years. Again, these are some of the things to look at. I've had little ones come to me with little to no speech, and very quickly they acquire language and words. So it's not totally a red flag. Definitely something to keep in mind. Out of the ordinary play includes spinning of toys, not playing with them appropriately, lining them up. I would definitely teach how you play with cars, make them go, make them stop. But these are just some red flags. It doesn't necessarily mean there's something wrong. Any questions about these ones? Okay. Okay, so excessive body rocking would be excessive movements for no reason, flapping of hands, moving your body back and forth. And it's for long periods of time over and over and over again. Excessive body rocking, the little ones at 18 months to 2 years aren't going to sit still. So that's not the red flag we're looking for. It's more abnormal behaviors. So little ones, they're busy. They're not going to sit still for a long time. Any questions? Okay. So these are red flags for 3 to 4 year olds. Persistent drooling, unclear speech, not using short sentences, there's no pretend play, doesn't use the word me or I. Again, only red flags, doesn't necessarily mean there's something wrong. Questions about these ones? We're good? Okay. So these are, again, red flags, 5 to 6 year olds. Some of the things we start looking at are if they're playing with other children, so we'll look at those social skills, the pragmatic skills, refusing to respond or interact with people just in general, rarely uses fantasy or imitative play. Again, if they're not engaging in fantasy play, it doesn't necessarily mean there's a red flag. It could just not be their thing too. Cannot talk about daily activities. I get this one a lot. So there's a difference between cannot talk about your daily activities and choosing not to talk about your daily activities. 5 and 6 year olds are not going to always want to tell you what they did throughout their day. It doesn't mean there's something wrong. Again, it goes back to sequencing and retelling and talking about daily events. Any questions about that? Yes.
When do we expect it to go from I played versus, I played on the tire swing or something like more detailed, like, what was your favorite thing today?
I played.
Playing.
My 8th graders still like that.
It's a hard one for sure. I see kids at school all day long and I'll ask them, what were you doing in class? Nothing. Well, you weren't doing nothing in class. Those are very typical responses. I guess it goes back to whether your child wants to tell you about his or her day or they don't, and versus whether they have the language to tell you about their day or if they don't. At that point, I would probably say, did you do this, or did you do this, and give them choices. Yes, did you guys do the things they did in class? They probably read a book. They probably counted and did some sort of numbers activity. They probably did a writing activity, reading, writing, and math, and asking them what they did for those certain areas to get more information. And then you could even, I don't know how old your little one is, 3, almost 4. Yeah, that's really when the beginning of sequencing and retelling comes about. But again, here that would be a red flag for a 5-year-old, 5 to 6 year old. So I wouldn't really worry about a 3-year-old. I mean, 3-year-old saying that they played, that's really personal to them. So what did you play with? Who did you play with?
When would we expect more, like at 5 to 6, like what would that look like?
You should be, so at 5 to 6, we're thinking of kindergartners. So if you ask a kindergartner what they did during their school day, they should be able to tell you what they did. They went to lunch, who they played with on the playground, what they did on the playground. Again, if they're not into reading and writing, then they probably won't tell you exactly what they did during reading and writing. But again, those events that are personal to them and that they really enjoy and are highly preferred, they should be able to at least give you a few more details about. Does that answer your question?
Question, going back to the 4-year-old slide. Regarding the last point about speech errors, she says, my 4-year-old stutters a lot, mostly when he's really excited. For example, he'll say, I want to play.
Mm-hmm.
Is that normal or a cause for concern?
Both. It's totally normal as little ones are acquiring language, especially when they're excited. They're going to have a hard time getting their words out. Their brains are going faster than their mouths are at that point. At 4, I would say it's from just that, not knowing the 4-year-old, I would say it's very developmentally appropriate at this time. Stuttering, our fancy word in speech is called fluency. It's stuttering. Is tricky. You definitely have to go through and see if they're repeating whole words, parts of words, those moments that are looking at, what's causing it, if there is a cause for it, to really be able to say whether it's something that needs to be an area of needs, that needs to be looked at, or if it's developmental. At 4, I would probably say keep an eye on it, don't call attention to it, and continue to model good language. Anything else? Anyone else? Yes. Sure.
Okay, you said not to bring attention to it. Okay, is there anything we can say, like slow down, or can you think about what you're saying, or take a break, or, instead of, I know they're probably excited and they want to get whatever they're saying out, but is there something or a phrase we can say to get them to calm down and think about what they're saying, instead of just saying, like, spit it out? Like, I've heard people say, spit it out, and I'm like,
no, that's not good.
Let your kid, I just...
No, what I would go through, I wouldn't call attention to it, so I wouldn't point it out. I would model what they said back slower than what they said, how they said it. Again, you could really slow it down for them at 3 and 4. It's the disfluencies, those moments of stutter, are going to go on for some time. It's totally developmentally appropriate. Everybody stutters at a certain point. Everybody stutters in conversation. Everybody. And when you're acquiring language, you're going to stutter more. Totally appropriate. Any other questions? Okay. These are some great resources. They're located within your PowerPoint presentation for you to go on and check out. The Hannon.org, it's a specific program that you can implement. The ASHA.org is our American Speech Hearing Association that all speech therapists belong to, and there are more or less our governing body and the rules and regulations we all attempt to follow. And ReadyRosie.com is a website that's great for little ones.
Just to share, so I did Hannon through the Tichenor Clinic.
Oh, awesome.
So there's a fairly substantial cost to do the Hannon program, but
Yes.
to do it at Tichenor, they have a fairly reduced rate. So they do it periodically.
Awesome. Good to know.
So you may want to contact Tichenor Clinic here in Long Beach, ask them when they might be doing a Hannon program again. I think the program's actually called It Takes Two to Read, I believe.
Yes, it takes two.
So you can ask them about that program and see if they're going to do it in the near future. And,
Yes.
put you on the contact list in case they're going to do it again.
Great to know. Thank you. Any other questions? So moving forward, we love to do things that are interactive. If you could just briefly turn to somebody at your table and tell them one thing you're going to do differently or more of at home and how you're going to remember to do this. Or if you guys have any questions at all, kind of wrapping it up. Okay, cool. Would anybody like to share one thing that they're going to do at home or do more of? You don't have to share. I'm one of those that I don't like to share either, so it's totally fine, totally fine.
I'm actually going to share what you said and talked about. To, what was it? To, you talked about modeling, and we talked about sequencing. Yes. Retelling.
Yes.
No. You actually talked about stating the answer prior to, the question, asking the question.
Yes,
I'm going to
front-loading.
try that because my 3-year-old, she'll think about it, and sometimes she'll answer the question, and other times she's like, I don't know. So I thought that was doing the wrong thing, like telling her the question and the answer first, but I did like that, because
Yes. Again, it goes back to just offering them language. I would start there. So I would start with, if it's a cat lives in a house, where does the cat live? To make it even more difficult, you could say, it's a cat lives in a house, the cat is black, where does the cat live? So you give them a piece of information in between the answer and the question. That would be another great strategy too, but it's scaffolding in that sort of sense. But it's always good to give them more information. So any other questions before we?
I did have a couple questions from parents who are watching at home. One from Cindy Ruiz. When is a good time to start using sign language with infants?
Right away, from birth. Sign language again, gestures, and talking to your little one right away.
And one more question, you kind of touched on it earlier, but to reiterate, how can I encourage continuing conversation, engaging in conversation, answering or asking questions? That's from Alexis. And I know you already spoke to that, but just maybe a quick
so that's, that
quick
one's going to
answer.
be a little bit tricky too, because it would be age specific. So again, I would probably give them their words, tell them your words are at this point, and model it again for them. I definitely always suggest saying, at this, like if I'm looking for a response or I'm looking for a targeted utterance during a speech session, I'll tell my students, your words are, model it for them, try, and then I give my prompt to get the words back from them. I'm a big fan of that too. So it's constant front loading when you're acquiring language. You have to give it to them in order for them to internalize it, understand it, and then say it back. So, of course. Any other questions? Yes.
Could you, because I know there's several letters of the alphabet that have different sounds, but can you go through the alphabet of what sounds that we should be saying? Like when we do ka, what the sound we should make? Because
For letter sounds?
letter sounds, because some of them have more than one sound. Which ones do we?
like A and
Yeah,
So,
Can you sing the alphabet in sound?
Using the alphabet and sound. That's probably going to be more of a gen ed teacher kindergarten question, but I would offer both sounds for every letter that they have. So I would do it just as you said, ah and yeah. It's just a simple sound in isolation by itself. I would leave off any sort of or vowel sound with it, so that you're not getting always having an interjection of a vowel sound after a consonant sound. It would just strictly do the sound by itself.
Like C, you have like city or.
No, that okay. So C. There goes that one's tricky too. It is, yes.
If I can offer, my daughter's in first grade and she's just learning the hard C and the soft C.
Yeah.
So I guess it depends on maybe the age of your child.
Yeah.
I mean, if I could just offer that, I mean, I wouldn't have thought to do that until my daughter had speech issues, but I feel like if I add on a long and a soft sound on some of them, it might confuse her. But if so I don't worry about it as much because my first grader is just learning a hard C and a soft C. So I guess maybe it depends on the age of the child.
And really I'm looking at sound production from a different standpoint than like teaching letter sounds. So that would probably be a great question for a gen ed teacher. I would go through learning the letters of the alphabet before learning their corresponding sounds, because again, that goes back to a bigger educational academic concept.
And if I could even segue, I know that next week's topic is going to be on language acquisition, and it's going to have a lot of sound development in there. So it's a good way to segue to next week's workshop. We'll be here next Tuesday at 1 o'clock as well from Educare. I'd like to thank Ms. Bowman for coming in today and giving us a lot of information, a lot of helpful information. One of the goals of Parent University is to really give parents tools so they can be an active partner in their child's education system and their education through Long Beach Unified. And so I know as a parent myself, I learned a lot today too. So thank you. Thank you for being here. Thanks for tuning in. This workshop will be posted on the Long Beach Schools YouTube page later this week. It will be in English and Spanish, and it will be available. So again, thanks for tuning in, and thanks, Ms. Bowman.
Thank you.